You may have heard of lithotripsy. This is the breaking apart of kidney stones using high energy pressure waves. The shockwave that we're talking about is the same technology, but for the muscles, ligaments, and tendons. Before I do that, I'd like to spend a minute or two talking about the nature of injuries and healing. It's important for you to know this so that you can appreciate the value of shockwave and understand how it works. When you sustain an injury, your body initiates the reparative process. A number of things happen during that, the most common being pain, redness, and swelling. Another thing that happens is that your body lays down what's called scar tissue. Scar tissue is your body's glue. You could think of it as looking somewhat like spider webs to connect an injury site, to connect two areas that have been separated. Well, oftentimes the scar tissue, which is laid down by special cells called fibroblasts, can build up and be excessive. Now this in itself can cause problems. If too much scar tissue builds up, then it could cause problems such as an excessive contraction of the muscle and joint, and that will inhibit full range of motion, restoring full range of motion. It can make it difficult for nerve endings to repopulate to that area, and they concentrate around the scar tissue, forming painful spots, so that's where your chronic pain comes in. As a matter of fact, that's one of the theories of what a trigger point is, a very tender spot of pain on your muscle. And it could inhibit revascularization. If too much scar tissue builds up at that injury site, the little capillaries that try to go back and restore blood to the injury site aren't able to penetrate because of that scar tissue. Well, shockwave is high energy pressure waves that moves through the injury site, and it can break apart excessive scar tissue. It could thin it out, leaving the strong, stable ones to remain. Another problem that often occurs is that those fibers can stick to adjacent muscles, and then this would impair proper movement and even strength. Shockwave can be helpful in breaking up those adhesions, preventing that from happening. Another thing that can happen when you've injured tissues is that the reparative process kind of flatlines. It remains at a stagnant state. But if you apply shockwave treatment to it in an injury that you feel may have plateaued, like you're not getting any better, not getting any worse, things have sort of stalled, you apply shockwave to the area and it causes micro trauma to the area. Basically stirs things up again, wakes things up, and gets that reparative process, it kick-starts it back up again. And these fibroblasts come back to life. The cells that remodel the scar tissue come back. Well, it just so happens I lifted weights a week ago, and I've got some tenderness in my biceps tendon and a little bit of epicondylitis, and I'll show you what it's like to use a shockwave on this. Here's the shockwave unit. It consists of the main console, the applicator, and it comes with an optional tablet that has preset protocols. You could operate it using the touchscreen or the tablet. Now the way it works is there is a metal rod inside this applicator, and it uses an electromagnetic type arrangement to accelerate the metal rod against the back of this treatment head right there, and you could interchange this with different sizes, and the smaller it is, the more focused the shockwave will be. You can control the applicator. It's got its own display here. You can manipulate the power and the frequency. And what I'll do, you press any of these buttons here, and I've just set it to a preset program 1. So with these shockwave machines, the three variables you can set are the intensity, the power of the shockwave, it's measured in megajoules, the frequency, like how many shots per second, and also the count, like how many shocks you'll get in your treatment. Intensity here, you can see it's 90 megajoules. Frequency is 8 hertz, and it's set for 1600 shocks. As far as how it feels, it kind of resembles a bunch of tiny needles poking your skin and going inside, and you may even sense sort of an electrical type shock sensation, although there is no electrical current going inside you. Again, it's a pressure wave that's going through the soft tissues, and sometimes it could stimulate nerves to the point where it mimics an electrical shock. But it's generally not painful. You may feel a little bit soreness and redness afterwards, but that's what you want. Remember, we're trying to break apart those tough fiber adhesions and also stir things up to aggravate the condition a little bit to get that healing process kick-started again. In summary, shockwave treatment is effective for treating joint and muscle pain, especially of the chronic nature. It uses high energy pressure waves to break apart excessive scar tissue. It improves the quality of the scar tissue that's laid down, and it could basically result in a more efficient and higher quality repair of your injury. If you have a joint problem and you want to try shockwave, you could call up chiropractic offices, physical therapy offices, and see if they have it as part of their services. And you could even get one yourself, because these days technology is making these therapeutic devices more compact and user-friendly. And what's happening is a lot of people like yourself are buying it directly and getting treatment at home, saving themselves a bunch of money. If you're interested in checking out the one that I used here in this video, just click the button in the upper corner of your screen and look below, and you'll see the link to it. Now stay tuned, because I'll be making more videos on how to use shockwave for different types of conditions. That's it for now. Thanks for watching. See you next time.